Welcome to The Explainer. Today, we're tackling a really powerful idea. What if your zip code actually matters more for your health than your genetic code?
Let's start with Kathy's story. It really gets to the heart of a huge flaw in our health system. She was having this awful stomach pain, but here's the catch. No insurance, no referral to a specialist. It took a community health worker named Cherie to help her cut through the red tape and finally get a colonoscopy. And that screening? It found cancer. Her biggest hurdle wasn't medical science, it was the system itself.
And look, Kathy's story, it's not a one-off. A staggering 41% of adults in the US are struggling with medical or dental debt. Think about that. For so many people, getting sick means going broke.
All right, so let's zoom out a bit from Kathy's story and really look at the scale of this problem. We're talking about the human cost of inequity. And it's not just about the debt you rack up after you get treated. The cost itself is a huge wall stopping people from getting care in the first place. Get this, about a third of all American adults, that's 36%, say they've had to skip or delay care just because they couldn't afford. And the hurdles go way beyond just money for the bill. Think about something as basic as getting to the doctor. For folks earning less than 50 grand a year, almost a third of them have trouble with transportation. That's more than double the rate for higher income families. I mean, how are you supposed to get well if you can't even get to the appointment? And these barriers, money, transportation, they have absolutely tragic real-world consequences. Just look at these numbers from 2022. The infant mortality rates for Black babies and for American Indian and Alaska Native babies were more than double the rate for white infants. These aren't just stats on a chart. They represent a systemic failure with the highest possible cost. Okay, so it's pretty clear the problem isn't just about medicine. So what is the root cause? It's time for a new diagnosis, one that looks way beyond the doctor's office. So think about it. What really makes us healthy? You might be surprised to learn that the clinical care we get, doctors, hospitals, medicine, that only accounts for about a quarter of our overall health.
So what's the other 75%? Well, it's this huge idea called social determinants of health, or SDOH for short. Basically, it's all the non-medical stuff, the conditions where we're born, where we live, and work that really truly shape our health every single day.
And these factors, they basically fall into 5 big buckets. We're talking about things like your economic stability, the quality of your education and healthcare access, your neighborhood and environment, and even your social and community connections. It's the whole picture of your life. To make this really concrete, let's just zero in on one of those, transportation. It's a huge barrier for 17% of all Americans. It's a perfect example of a problem that's not medical at all, which means it needs a solution that isn't just about medicine. So this all points to a totally different kind of solution, one that's not about some fancy new technology or drug, but about something much simpler, human connection. We need to build bridges to better health.
Let's go back to where we started, in places like rural South Carolina. A really vital new role is popping up to tackle these non-medical barriers head-on, with support from groups like the Center for Community Health Alignment.
So what is this role? They're called community health workers, or CHWs. And as one CHW supervisor, Nora Curriel-Munoz, says, we try to be that bridge between the community and the service providers. They're trusted people from the community who help their neighbors navigate what can be a really confusing and overwhelming system. And these CHWs do so much more than just book appointments. They're there for social support. They're advocates. They connect people to real, tangible help like transportation, food, financial aid, the whole 9 yards. And remember Kathy? Her CHW, Cherie, she was that human bridge. She's the one who helped Kathy get the diagnosis that literally saved her life.
Now, community health workers are an amazing solution on the ground. But here's the thing. You can't fix a huge systemic problem with just individual effort. The whole system, from the top down, has to be rewired to support this kind of work.
So, how do you even begin to do that? Well, organizations like NACCHO, that's the National Association of County and City Health Officials, they provide a framework, kind of like a roadmap. It helps communities systematically spot the problems, create new policies, and actually see if they're working. It's about tackling the root causes.
And this kind of change, it has to happen on every level. You've got your big P policy, think major laws, like a state expanding Medicaid. Then you have medium P, which are rules for community groups working together. And then you have little p policy. That could be as simple as one clinic changing its hours so working parents can actually make it to their appointments. Every single level matters.
And we need this kind of rewiring urgently. I mean, the Commonwealth Fund put it very bluntly. The U.S. keeps spending these vast amounts of money for, frankly, poor results. It's the very definition of a low-value health system. We spend the most of any high-income country and get the worst outcomes. Something has to change.
Okay, so a huge piece of this puzzle is changing how we actually pay for healthcare. For a long time, we've used a fee-for-service model. Basically, doctors get paid for the quantity of stuff they do. More tests, more procedures. The new idea is value-based care, where we pay for good health outcomes. This completely flips the script. Now, there's a real financial reason for doctors to address those social determinants of health because keeping people healthy is how you win.
So where does this all lead? What's the prognosis for our health? Well, it's about making a huge shift from sickness to wellness.
So, by really focusing on those social determinants of health, by rewiring our policies from top to bottom, and by changing how we pay for care to reward value, not volume, we can make a truly fundamental shift. The end game here is to transform a system that was built to treat sickness into one that actually, proactively, builds and sustains wellness in our communities.
And that really leaves us with the big, critical question we all need to think about. Our health system was built to react to illness after it's already there. So what is it really going to take to redesign it from the ground up, to create a system that delivers wellness for every single one of us?